I have encountered lots of patients that have suffered from sexual assault, and that has just kind of bothered me over the course of my career, and I would just felt called to do maybe more in that area to help that particular subset of people. So I went to Karen Scott, our very, very nice director of SANE nursing here, and just kind of asked her about the process whenever I first became a nurse, honestly, in postpartum, and she told me to get a little bit more experience. So a couple years experience first, and then I went back to her and said, okay, I'm ready to do this, and she has given me a long checklist of skills to get through. So I just, in fact, yesterday completed all of the speculum exams I needed to do with either a physician or a midwife, and I got all of those done. So I'm just waiting on that next part of the process to get going, which would be shadowing Karen, and also shadowing a SANE nurse and kind of following them and learning the process of all of that. I think first and foremost, it is very important to have that asset for the community so we can provide support and really be a safe place for people that come in and have unfortunately experienced that. Safety first, absolutely. Being someone there that is able to listen to those people that come in and have experienced that. So safety first for them, and providing a listening ear, just making sure that they get the care that they deserve. Tons and tons of empathy go a long way in that situation, and I think that was something that I really wanted to highlight going into this. I want to remain so empathetic to the people that have experienced that, because I can't imagine how difficult of a time that would be. I think it's just important to have that resource available to the community. I wish people understood that that is available 24/7. It doesn't matter what time of night that is. If you need to come in for that, come and see us. That is absolutely a-okay. I also wish there wasn't quite a stigma surrounding reporting those things. Obviously, that is whoever's choice. I absolutely do not push either way for that. But that is we're not here again to pass judgment in any sort of capacity. We're here to support whatever decisions they'd like to make. So I wish that everyone kind of knew that if you come in and talk to us, you absolutely don't have to report any kind of crime to law enforcement. That is not a requirement to seek help after that. But you're absolutely welcome to come and get medical care regardless of if you want to report or not. My advice to that person would be, understand that we have seen and heard quite literally everything. There is never any moments to pass judgment upon a patient that is coming in for that. It is absolutely understandable to be embarrassed by that, but please do not feel as though the person that is taking care of you is going to contribute to that. We understand that it is a sometimes long and difficult process in order to seek care after that, but we are here for you to provide you a safe and comforting environment as much as we possibly can in those trying moments afterwards.